AP Psychology, States of Consciousness. Consciousness is defined generally as our awareness of ourselves and our environments, and the environment includes both the internal and external environment. Sleep and dreams are two of the most interesting aspects of psychology in general, and of particular interest to recent psychological science. Our bodies and our minds operate on biological rhythms, and we have periodic physiological fluctuations in these rhythms. For example, we find that sometime around mid-afternoon we might find ourselves getting a little bit grouchy and hungry, and we might find we need a little shot of glucose, a little snack, in order to restore our mood and our concentration. This is due to the circadian rhythm, which is an internal biological clock, and as you know from class, the SCN, the suprachiasmatic nucleus, is especially important in the functioning of the circadian rhythm. And we have a bodily rhythm which operates on roughly a 24-hour cycle, from waking up in the morning to going to sleep at night. And of course, throughout the night as our body goes through various changes from dream sleep to non-dream sleep to tissue repair, fighting off disease, and the like. REM sleep, rapid eye movement sleep, is the time in sleep when we go through most, but not all, dreams. But for our purposes right now, we will think of REM sleep as being the dream state of sleep to simplify things. And the dreams are typically very vivid, and they can be very wild, and we typically remember the dreams that have the most emotional impact. Joy, sadness, fear, and so on. REM sleep is also sometimes known as paradoxical sleep because our major muscle groups are paralyzed, so we don't act out our dreams, but our brain, in fact, is very, very active. And sleep can best be defined as a periodic, natural, and reversible loss of consciousness. If it doesn't become reversible, then we would call it a coma. And of course, coma is slightly different. Well, not slightly, actually. Very different from sleep. Scientists typically use an EEG, an electroencephalograph, to measure sleep activity, and they want to measure brain waves, they want to measure eye movements, and they want to measure muscle tension during sleep, especially if they're attempting, if it's a doctor trying to diagnose a sleep disorder. And you can see here, as we've seen in class, the various configurations of waves that occur during sleep. Alpha waves are the awake and relaxed state, just between sleeping and waking, right down to REM sleep, which is very similar, as we discussed in class, to the waves that are obvious during our normal waking selves, our normal waking consciousness. We might experience hallucinations just as we fall into sleep, or just between waking and sleeping. This is called the hypnagogic state, and we might believe we hear noises, and we might have muscle twitches and so on as we relax into sleep. And here are the typical stages in a typical night's sleep. And remember, an 8-hour sleep is an average. It takes into account the long duration of sleep throughout a 24-hour cycle of the infant, right up to and including the relatively short sleep of somebody who is 65 years and older. And you can see here that as we go through the night, in the first 4 hours of sleep, we spend a lot of time in stage 3 and 4 sleep, where we're fighting off disease and we are repairing body tissue. And then as night goes on, we spend more time in REM sleep as we are dreaming and, among other things, filing information away for future use, rehearsing new learning through dreaming, which we've had during the day, and in fact, from a cognitive point of view, maybe even solving problems while we are asleep. And you can see here the minutes of stage 4 and REM sleep during the various hours of sleep. REM in the red and stage 4 sleep in the green. Sleep deprivation we've discussed in class, and it is a major problem in our society because it is making people ill and, in fact, making us less cognitively able. We are unable to concentrate as well when we are sleep deprived. We are more likely to become ill because our immune system is depressed, and we are more likely to lose coordination and therefore become more vulnerable to accidents while we are sleep deprived. As we discussed in class, the optimal or optimum amount of sleep per night for people in your age group is about 9.25 hours, and in most cases you're not getting it. Here we see some of the results of sleep deprivation at the time change in the spring and in the autumn. Sleep disorders we didn't discuss in a lot of detail in class, but obviously they're things you want to know for the purposes of tests and exams. The definitions are fairly straightforward, and there's not a lot of difficulty in understanding what they're about. Insomnia involves persistent problems in falling or staying asleep. Narcolepsy is uncontrollable sleep attacks where the person will slip directly into REM sleep while fully conscious, and this has to do with a faulty switching mechanism in the brainstem, and it can be treated with drugs. Not the only, but one major drawback of narcolepsy is that obviously you can't be licensed to drive a car with this condition. Sleep apnea is becoming more and more a problem, particularly as more and more people consume alcohol and more people gain weight. It's a problem to be found in other populations, but especially among those who are heavy drinkers and who are overweight. Night terrors happen during deep stage 4 sleep, and they're not the same as nightmares. A nightmare is a dream. It's a horrible dream, but it's a dream nevertheless. And night terrors, the person will appear to wake up with trembling and possibly screaming and so on while they are sound asleep. And it's very difficult to bring them out of it because they're in stage 4 sleep, and it's very difficult to bring anybody out of stage 4 sleep under any circumstances. We talked about the Freudian perspective of dreams in class, and Freud, even though not a lot of people really agree with his interpretation of dreams anymore, was the first person to take dreams really seriously from a scientific point of view, and is one great contribution, well, not one, but certainly one of his great contributions to psychology and medicine, I suppose, is that he gave us to understand that physical problems can have psychological causes. And he would do an examination of a patient who, for example, had no feeling in their right arm below the elbow. He would do a full neurological examination and find that the patient had no brain damage or nerve damage, so therefore why did they have this problem? And he believed it resulted from a repressed traumatic experience while in childhood, and he believed that this traumatic experience could somehow be revealed through the dreams the person has and the interpretation of those dreams. And more details about Freud, which we have talked about in class. We also spoke briefly about dreams as information processing, that is to say a filing system which helps us to file away in the appropriate location information that we learn during the day, either in class or elsewhere, which we're going to need to access in the future. And we know that if we are sleep deprived, that we go through something called a REM rebound when we finally go back to a period of having adequate sleep, and we'll spend a lot more time in REM sleep than we normally would. And this seems to be because our brain is responding to the fact that we need that REM in order to function properly cognitively and emotionally in our lives. So therefore the brain will naturally default to putting in more time in REM sleep in order to make up for the loss in the previous days and weeks of sleep deprivation. Here we see the relative hours of the various stages of sleep over the lifespan. Hypnosis we did not talk about in class. However, there are many misconceptions about hypnosis. Hypnosis is sometimes used in magic shows, and that can be a lot of fun, but the kind of hypnosis that we're talking about for psychology is a hypnosis which is used to treat illness. And there are many claims made for hypnosis, many of which are false, but there are some things for which hypnosis is very effective, and that is for overcoming anxiety and fear, particularly when it comes to controlling pain. So doctors and dentists may well use simple hypnosis to help somebody overcome the anxiety and fear of a procedure, which is not going to involve an anesthetic, and that in fact, and has been demonstrated to reduce the pain that the patient experiences. There is a lot of there are a lot of false claims about hypnosis, as we can see here. And there are very few things that you would do under hypnosis that you wouldn't otherwise be able to do. Also, hypnosis can be abused by unscrupulous individuals who will lead people to believe that they can, in fact, regress to previous memories which they've repressed, or in fact, in some cases, to previous lives. And these people are charlatans. They're not telling the truth. There's no scientific evidence that either of those things can be done. Now to drugs and consciousness. We've discussed these in quite a bit of detail in class. Remember that a psychoactive drug, typically we refer to the drugs that we use recreationally, not we, but one uses recreationally. And psychotropic drugs are the drugs that are typically prescribed by a psychiatrist or other medical professional to deal with a psychiatric disorder. Also remember the key difference between addiction and dependence. Here, addiction is referred to as physical dependence, and that is, in that case, the person needs the drug in order to feel normal. That's why an alcoholic will often have a drink upon waking up first thing in the morning to do away with the headache and dry mouth and shakes that they're experiencing. Whereas psychological dependence, as I mentioned in class, we might have the case of a social drinker who only has a couple of drinks at a party in order to relax a little bit and to overcome some shyness, but otherwise does not drink at all in the course of their lives. The person who is on the way to becoming physically dependent on the drug experiences tolerance over time and will need more of the drug in order to experience the same high or the same effect that they found so pleasant first time around. And withdrawal is the unpleasant physical reaction to the absence of the drug. So in the case of the alcoholic, that is typically shakes, dry mouth, headache, and psychologically irritability. And the drug needs to be re-administered in order for the person to feel normal again. As you know, psychoactive drugs are divided into typically 4 categories: depressants and stimulants, which have more or less opposite effects on the nervous system. The most widely used depressant in the world is alcohol, and the most widely used stimulant is caffeine. Hallucinogens alter sensory experience and perception, and as I mentioned in class, hallucinogens now are under investigation again to help people who are nearing the end of their lives owing to a terminal illness and who are very afraid of dying to come to terms with or develop a meaning in life and a belief in the possibility of an afterlife, or at the very least a belief in the possibility that their life has meaning beyond merely their physical living of it during their lifetime, And what researchers are finding is that these people overcome their fear and have a much better perspective on their lives and their place in the universe than they had previously. And typically LSD is being used to do this. Barbiturates usually occur in the form of sleeping pills. Can be helpful in the short term, can be very dangerous in the long term. Opiates are painkillers such as morphine, and morphine is what is used in hospitals, and what we call heroin on the street is essentially the same stuff as morphine. But as we discussed in class, the person who's using morphine to control pain has very different expectations from the person who becomes addicted to heroin and is hoping that heroin will solve all of their life's problems. So it's the same stuff going into the person's bloodstream, but in the one case, the person's expectation is that I'll use this to control pain, and therefore, and will be done with it once I've overcome this particular illness or recovered from the surgery. But that's not the case with the person who uses it as heroin. The person who uses it as heroin expects that it's going to solve problems that it can't possibly solve, and therefore is much more likely to become addicted to it. Typical amphetamines are cocaine, and of course, cocaine is not an amphetamine. Cocaine is naturally occurring stimulant. Methamphetamine, commonly known as speed, is the most widely used amphetamine. And we did talk about this a little bit in the neuroscience unit, but you can see right here the mechanism of action for cocaine once again. As we discussed in class, when ecstasy came on the scene, people thought they'd finally found a safe drug with very few side effects, and a drug which would do very little physical damage, which people could use responsibly, just as supposedly alcohol can be used responsibly, with very little damage done either to themselves or others. Unfortunately, that's not true. And one of the main drawbacks of using ecstasy is that ecstasy can damage and does damage the serotonin producing neurons in the brain, which results in a depression which cannot be treated because the hardware, those neurons, which are the little laptop computers, the ecstasy is smashed up. And much as a psychiatrist might prescribe an antidepressant, there is no way for that depression to be reversed because the antidepressant does not have the correct neurons to work on. Handy chart for study purposes. And you can see here an interesting chart which we didn't have a chance to look at in class, but this shows from the mid-70s to the late 90s the relative change in use of certain drugs among high school students. Cocaine remains very low, probably because of the cost. Marijuana and alcohol remain relatively high, with alcohol at the highest level. Here you see a difference in the perception of marijuana risk over the years as well. Take a moment to have a look at this and draw your own conclusions. Going back to our wormhole video right at the beginning of the unit, there are people who experience near-death experiences, and this psychologist would consider this an altered state of consciousness resulting from a brain that's deprived of oxygen. But as you know from our discussion in class regarding the little video we saw from the Through the Wormhole series, not everybody necessarily agrees with that. And there are some people who believe that they have evidence for life after death through these near-death experiences. Might be something you want to investigate on your own at some point in the future.